Tonight, we continue our week-long series on the coronavirus and what we've learned over the past year. Here in Massachusetts, more than 500,000 people have been infected with COVID-19. And according to Johns Hopkins University, almost 400,000 of them have recovered. But over the last 12 months, we have heard repeatedly about people who experience effects long after their diagnosis. Dr. Mallika Marshall joins me live right now. And Doctor, I gotta ask, how common are these long-term effects from COVID-19?
So, Lisa, first of all, I think people should know that most people with COVID-19 do recover within 1 to 2 weeks of getting infected. But there are people who can continue to have symptoms for weeks, sometimes months. In fact, it's estimated that about 10% of COVID-19 patients will have long-term effects. This can happen to people who've never been hospitalized. It can happen to people with mild symptoms. It can happen to people who are young and otherwise healthy. And scientists are obviously trying to figure out why. In fact, the CDC is now tracking data to figure out which symptoms are more likely to persist, how long they likely persist, and who's most at risk of having that problem.
Well, Doctor, back in December, we spoke with Zach Whitman, who was experiencing symptoms 7 months after getting out of the hospital. Here's what he said.
The things that have really stood out is, the constant migraines, brain fog, and then like heart arrhythmias. I like to describe it as my heart's having a panic attack, but my body's not.
Okay, so that's what Zach was dealing with, Doctor. What are the most common symptoms that people continue to experience?
Sounds like the biggest one is fatigue, where people feel like they just can't get out of bed. Other common symptoms are shortness of breath, cough, joint pains, chest pain, and then symptoms like Zach was describing, with headaches and brain fog, where it just feels like you're not thinking clearly, muscle pain, intermittent fevers that can last for a long time, as well as those palpitations.
And some people do experience more serious problems too, yes?
That's right. It's rare, but it can occur. And we know that COVID-19 can affect almost any body system. So you can have persistent inflammation in the heart, can cause problems with the lungs, the kidneys. People report depression and anxiety. And then, of course, you know about the loss of taste and smell, which in most people does recover, but some people have those long-term symptoms. And we just don't know how long they last and whether people will make a full recovery.
So on top of that, do we know what causes these long-term symptoms?
Of course, it's not completely understood. Is it the acute infection itself that's causing inflammation? Is it persistent infection? Is it ongoing inflammation even after the infection has resolved? And then there are other factors that might contribute. For example, the overall health of the patient. Does he or she have underlying medical problems? What is their baseline mental health? What is their fitness level? And what treatments may they have received for their COVID-19 diagnosis?
You just feel so terrible for people who are continuing to go through that. Here's a question. Should these long haulers then still get vaccinated against COVID-19?
Yes, I think the consensus is that they should get vaccinated, but wait until they are past the acute infection and feeling a little better.
What are doctors doing right now to take care of these patients?
So there are these post-COVID care centers that are popping up around the country. In fact, here in Massachusetts, Spalding Rehab and Mass General have combined to create something called the COVID Rehabilitation Program, which is designed for patients with these long-term effects from COVID. So if you want to find out more information about that program, you can go to our website at cbsboston.com.
Well, if anybody can help, they can. Dr. Mallika Marshall, thank you so much.